So hello everyone and welcome to our this session in our G2H2 series of policy debate ahead of the Executive Board 156. My name is Alessandra and I am the Executive Secretary at Geneva Global Health Hub. Geneva Global Health Hub, for those of you who do not know us, is a network of civil society organizations which was built in 2016 with the aim to provide a space for civil society, but not only, also research institutions and universities to meet, to share knowledge, and also to create common joint initiative, projects, activities, and engage also in joint advocacy within the international Geneva. If you like G2H2, if you follow G2H2, if you want to engage more with G2H2, please do so, join and support us. I will put my email address in the chat below in a few minutes, and you're ready to use and copy it to send me an email and to get to know more about G2H2. As you can see on the screen, today is our fourth day in our series of policy debates. As you may see, we do have some topics that are more related to the Executive Board items and other topics that have been, we may say, neglected by the Executive Board, but nevertheless are matters that really matter to us. I do have the pleasure to present you this very, very interesting session today on energy transition and health rights, which is a very interesting topic that G2H2 has never dealt with before. So really stay tuned. We do have an amazing panel of speakers that are coming from all over the world. So for some of them, it's very early in the morning now. So really, thank you so much for being here. The session has been organized by Society for International Development, and the moderator is Pasi Amayo. Just a few housekeeping rules before giving the word to Pasi. The session is in English. There is no interpretation available. The session is recorded. So tomorrow morning, if you take a trip with the G2H2 website, you can re-listen to the session, and you can also have access to the full documentation, slides, and additional materials that are useful. To engage in the discussion, you can raise your virtual hand, and then we will unmute you, and you can pose your question. And then you have a chat at that it's there at your disposal if you want to present yourself, if you want to ask some questions, or if you want to add some materials and reference. And without further ado, I leave you to this fantastic session, and thank you so much for being here. And I enjoy the discussion. Pasi, the floor is yours.
Thank you very, very much, Alessandra, for that beautiful introduction. And thank you to all of you for joining us for this amazing debate. It is an honor for me to be one of the people who facilitate us into the very first energy transition health rights conversation at the G2H2. So very, very exciting and a very good pioneering moment for all of us. Today's discussion brings us to the world of energy transition, which is basically the move by the global energy sector away from hydrocarbons or fossil fuels, if you like, into a world that looks at what some people call renewable, sustainable, clean. It depends on what area you tackle the subject from, energy. And today we are going to have discussions, some critical, some deep, some diverse perspectives on where the energy transition story meets health rights vis-a-vis human rights. And we have an incredible set of speakers that are going to give us a deep dive from their experience and their expertise on these different subjects. And you will be welcome also to give your perspective, to ask questions, questions and to interact with the expert speakers that we have from different parts of the world. This conversation is designed in such a way that we do not only discuss the past issues or past debates relating to these subjects, but we're going to look at some of the current affairs, some of the critical issues that are affecting energy transition in the context of health rights. But we're also going to be using this opportunity to find some solutions that we can channel to the different stakeholders in this space, including not just the member states or our countries that make decisions on our behalf, but also the other important stakeholders such as civil society, the private sector, indigenous peoples, grassroots communities, and the list goes on and on. Just to say, in the quest for sustainable energy future for all in the context of health rights, it is something for all of us to be a part of. And this is a great opportunity to leave no one behind, but to all come on board so that we are truly meeting that sustainable, but also healthy energy future that we're all looking forward to this year, next year, and even beyond. So without any further ado, I'm going to invite first, for the first round, each panelist to give us a very, very brief introduction of themselves, because I do not want to misrepresent, and then we're going to dive straight into the conversation. So the first speaker I bring to you this morning for a very short introduction is Ms. Shalom Ibo. Shalom.
Thank you so much, Passy. Thank you so much, everyone, for joining. It's a pleasure to be here. I wanted to also extend my gratitude to the Society for International Development for extending a warm invitation to me. And this topic is very should I say, very dear to my heart. So I'm really excited about the discussions here. I'm Shalom Ibo. I'm originally from Nigeria, but I'm currently doing my doctoral program in chemical engineering at the University of Florida. And on the sideline, I also the founder of Renew Arts Technologies, and it's an organization that is focused on mobilizing young people and women in clean energy technologies and renewable energy education. And so it's my pleasure to be here to contribute both on, the grassroots community work that we do, as well as how it intersects with energy transition and health, right? Thank you so much, Percy.
Thank you and welcome, Shalom, to the conversation today. Ida Kiangi, I'm going to give you the floor to say hello to us and tell us a little bit about yourself.
Thank you, and hello, everyone. My name is Ida Kiangi, based out in Tanzania, Dar es Salaam to be specific. I've been in the energy sector for the last almost 10, 14 years now, mostly on utility side renewable projects, but also overseeing mini grids in some of the remote areas of Tanzania, and specifically probably the largest mini grid company in the country with over 10,000 customers on the Lake Victoria, and on the northwest side in Kigoma. So I'm really looking forward to this discussion, and definitely just positioning it with health will be a first for me. So I'm really, really excited to learn a lot. Thank you.
Truly an exciting day for all of us today. We're looking forward to what you bring into the conversation, Ida, so feel very, very welcome. I'm going to transition us from the motherland into other motherlands. So Lawrence, Angela, this is your opportunity to say hi and briefly introduce yourself.
Thank you so much, Amayo. I also want to express my gratitude for your invitation to me to this very interesting talk, and also thanks a lot for the technical assistance from Alessandra. Yeah, I'm Lawrence. I'm a climate activist based in Switzerland. Over the past few years, I've been engaged with a variety of NGOs to promote climate action in Switzerland, but also abroad and internationally. Professionally, I'm more focused on research, or have been focused on research on SDG 16 indicator measurement, as well as inequalities within Switzerland. And in the past, I've had the opportunity to represent Switzerland in international climate negotiations. So I hope to bring in this more practical perspective on the policymaking process a bit as well.
Welcome, Lawrence, and we're looking forward to discussing those inequalities and how security and health rights and energy transition meet in the middle. Last but not least, Nicoletta Dentica, you have the mic.
Thank you so much, Passy, and thank you for making this policy dialogue happen. To you, particularly to Alessandra, Alice, and also the panelists. I'm really very thrilled for this premiere by SID. I work in SID. I lead the Global Health Justice program, and I have been involved in global public health policies, let's put it this way, for the last 25 years at least, since 1999, to be more concrete. And I'm really thrilled to enter this territory, which, as Alessandra was saying before, is not really very much, populated or occupied. And so there is a lot of space in which we can codify and interpret policies the way we want. I also teach global health at the University La Sapienza in Rome. Thank you so much.
Thank you, Nicoletta. And I'm going to break the rules a little bit and invite Alicia. She's been an incredible help to just say a quick hello, and then we're going to dive into the conversation. Alicia.
Thank you, Passy. Mine will be indeed a very quick hi, just to be equally exciting, echoing everyone and welcoming everyone to this webinar. Thank you. Enjoy.
Brilliant. Thank you for that and for the help, and everybody else who helped us to put this conversation together. Emily, Chergazier, I can mention a couple of people, but I will wait till the very end. So friends, colleagues, let's dive straight into this. And I had to do like a toss the coin thing to know who is going to start first. I've kind of reworked my thing a little bit because now I've heard where you're all coming from. So I'm going to start with you, Shalom, and I hope that's okay. And I do that strategically. Take us into this conversation on energy transition and health rights from an African perspective, from a youth perspective. You also have the privilege of working with young girls, and you have been embarking in this subject of renewable energy education. At what point does education and the gender issues meet energy transition and health rights in the continent and beyond, based on your expertise and experience?
Thank you so much. Confirm that you can see my slide? Okay, perfect. Thank you so much, Passy. I was hoping to leverage other speakers' insights before introducing mine, but nonetheless, I'm very excited about the topic, and thank you so much, Passy, for kickstarting the conversation this way. And the topic of energy transition really is important to me. Growing up, like Passy had mentioned, being from Nigeria, a lot of the issues, the central issue that we face in Nigeria, it's usually energy poverty. And I designed this slide to really show the interconnections between energy systems and human health, and then how that also translates into different sectors. And so the first one that I really wanted to emphasize on is just to bring the statistics into the picture about how the energy transition and the different renewable energy technology, the fossil fuels, are contributing to the health challenges that most people face. And in worst cases, like we see here, mortality. And so we see that air pollution and energy poverty are claiming lives. And we have statistics backing that up. Over 7 million people a year die from air pollution. And 2/3 of this is results from burning fossil fuels. And we even see the statistics largely in the clean food cooking sector, where you see 2.3 billion people lacking access to clean cooking fuels. And this particular statistics highlights how far we have leveraged fossil fuels, and yes, is for development and economic growth, but we can also see the adverse impact of fossil fuels. And that is the reason why we all believe, and we are all here to discuss the energy transition. And just to connect it to my next point, which is what I reiterate at every point, and the major reason why we started Renewable Earth Technologies was to promote clean energy systems, and also to emphasize that energy access is a fundamental human right. So it's not just for people that can afford it. We advocate for even people that are in low-income communities, disabled people, people that are that are displaced, so climate displaced people, forced migrated people. We also advocate for them because, backing it up with what the former UN United Nations Secretary General mentioned about energy access being the golden thread that connects economic growth, social equity, and environmental sustainability, we can see that both on the economic side and the individual perspective, everyone grows when they have much more access to energy. And so when we go to communities, we go to schools, we are teaching them about climate change. We are also emphasizing to them that not just about having energy, they'll also consider clean energy adoption. And this is also relating to the third issue that I wanted to just highlight, which is that it's a solution and also something that has been driven by previous encounters. I came across a document that said over 400 climate litigations have been made, and 44% of that is towards the solar and wind sector. So we see a lot of companies, private sector, expanding large-scale renewable energy technologies, but infringing on the people's rights. And so most of the land that is being used, explored, okay, let's say from critical mining, mineral mining, we see that most of those land are, land portions that these farmers they would normally use for agriculture, but now they have, repurposed those lands into used for renewable energy deployment. And you see that aside the impact of land use infringing on land, we also see situations where, installing wind systems will also cause noise pollution. And so some of these challenges needs to be incorporated at the very start of designing energy systems. And that is why discussions like this are very critical, because it helps to inform people, but on the private sector, public sector, investors, to also consider these situations, making sure that energy transition and the technologies that are developed are both locally led and community driven. And diversifying how local actions still contribute to energy transition, gender is also at the center of this, because when it comes to a lot of the energy sources, including cooking fuels, we see women are the ones that bear the brunt of the climate impact that is associated with these energy sources. And so energy systems need to be designed in a way that considers women and even prioritize their health. Take, for instance, we have nuclear systems. So if you want to promote gender equality or equity and offer jobs to women in this space, you have to also prepare for them, protection. You also have to prepare, put security measures in place to ensure that they do not face the adverse effects from, for example, nuclear radiation from the nuclear reactors. And also, there was this study that I came across also from the University of Oxford in collaboration with the Chinese academy. They closely researched and saw that there was a linkage between fuels, the biomass systems, with lung diseases and even blindness. And so these are critical, yes, and these are critical issues that needs to be highlighted from the beginning. So when we think about clean cooking systems, we should also think about systems that would not impose or infringe on their health, that wouldn't expose them to pollution, and also would not expose them to any infertility, because research has it that nuclear radiation causes infertility. early menopause for women, and even on the men's side, it causes low sperm count. So you can see that it's an equal gender issue. So like both on the male side, the female side, there are really issues that we need to work on before, keep expanding energy or these clean energy systems. And this next point is closely related to the research that I'm currently doing here at the University of Florida. And this particular theory is the concept of planetary boundaries is saying that the Earth has a carrying capacity. That means there's a limit to which human can thrive and strive within using the Earth's resources. And the current statistics on the planetary boundaries is that 6 out of the 9 limits has been transgressed. And within the 6, 3 of them closely relate to human health. And so climate change, we know about air pollution. Biosphere integrity is based on the concept of biodiversity and ecosystem uses and resources. So, and all of this, you can also trace that to toxicity. So it's important that while we are thinking about revolutions, innovations, because when you look at the novel entities, they really encapsulate things like, synthetic chemicals coming from nuclear reactors or even GMOs. We are all thinking about innovation, and some of these innovations are now contributing to the hazards that we are experiencing in our planet. And so whatever energy models that needs to be designed, it's important for both people at the technological side and the policy side to understand that energy models should be within planetary boundaries limits to be able to advance sustainability. And the last factor, which is something that I know that will come up later, and I think it's something that we reiterate a lot, is enabling climate finance, and not just for ramping up energy and energy access or bringing up the technology. We also think about the healthcare costs, the facilities, making sure that the finance process is participatory, is equal, not discriminating, and transparent. So I close with just a little view of some of the advocacies that we've done, both in Nigeria, Benin Republic, and we also have energy educators across the world. And our major goal is to promote the renewable energy technology that we have developed, which is targeted to end the use of kerosene lamps, and also to promote education, climate and renewable energy education, and majorly solar skills for the young people, preparing them for a sustainable future. I hope I didn't talk too much, but thank you so much, Pasi. And
No.
questions. Thank you.
No, you didn't speak too much. And now everybody understands why you were the perfect person to start us off with this conversation, because you've taken us through the whole cycle of what the energy transition debacle is about and where health rights come into play. And I think that was a brilliant way to start this conversation. One thing that I really picked up, including everything else, was this issue of the tech issue and this whole conundrum about how the tech revolution and innovations are a positive way to develop moving forward, especially in the energy transition question and sector, including in the health space, obviously. But also people tend to ignore the health hazards and the security hazards that come with, adopting this new technology for the purpose of either meeting universal energy access or universal quality healthcare for everybody, which is something that I hope we're going to deep dive into. And the other thing that I picked up is this conversation about over 400 climate litigation cases that have been passed on especially when it comes to the use and development of solar and wind in large scale and how this has affected livelihoods in different parts of the world. And a good friend of ours is in the participants. He wrote, Samuel Otatia, who wrote a brilliant paper on how renewable energy developments in Kenya are affecting livelihoods in the Maasai community. Something that I think we should pick up, and I believe many of us are going to tackle that when we do give our interventions. But Shalom, you closed with the subject of climate finance. And that is the entry point that I'm going to invite Lawrence to pick up from, just because these issues that Shalom has talked about, and she gave us very brilliant, strong, heavy points on what is happening, what needs to be done, and what could be done. I won't repeat them. But there has been another debacle and another debate about how do we finance energy transition in a just, healthy manner moving forward, not just in the context of energy transition, but also from a context of climate change. And when you bring in the subject of health and how people's safety and planetary health is affected in the midst of this, is where are we and how are we doing in the context of climate finance? But as I give you the mic, this is just an entry point. This is your opportunity to bring all the other points that you brought to this debate. So I'm handing the mic over to you, Lawrence, as we welcome Zagi into the conversation. Lawrence.
Thank you so much, Passy. It's, yeah, climate finance truly is a big talking point. It's also been over the last few years, and especially also when we look at it from an international point of view, where the last conference of the party in Baku has had this very specific talking point for the new collective quantified goal. And as you already mentioned, it's still very much a work in progress. So I would personally like to start a bit with elaborating on what are a bit more specific the health components of the energy transitions, or more specifically of climate change, in the sense of what are the health implications should the energy transition not manifest in a meaningful or quick enough time frame. And I'll keep it a bit shorter because we already had quite a few very interesting insights from Shalom, so I'm not going to repeat them, but I still think it's convenient to see what is it that we are actually facing. And here it's the increased frequency and intensity of extreme weather events like heat waves, floods, or heavy rainfall lead to increased morbidity and mortality. And higher temperatures or heavy rain will also increase the spread of disease and the risk of infection, and also in new geographic areas that are not yet prepared to handle those challenges. Then there will also be increased mental health challenges, including through anxiety or stress. Food security and safety will be an increasing challenge because of droughts and corresponding spikes in food prices, and of course the resulting food insecurity. And because of increasing temperatures, people will be less able to work outside, reducing the production capacity for food. Similar to diseases for human or affecting humans directly, there will also be more pests and disease outbreaks in crops and livestock. And as marine life will continue to decrease, it will also, of course, pose a danger to people who rely on fishing for their daily livelihoods. However, as we've already talked a bit about inequality, it's also important to stress that not everybody is equally vulnerable to all of these consequences. Often people from developing countries are highly vulnerable. However, it's not just geographic location, it's also marginalization or inequality due to gender, ethnicity, or income that may increase vulnerability. And the same also often holds true for indigenous peoples and local communities. I'd like to give two specific examples to kind of make it a bit more easy to imagine. And one is that the mortality rate from floods, droughts, and storms is 15 times higher for people from vulnerable contexts. And the second point being that children from low-income countries are more vulnerable to malnutrition because they live in contexts where food is less available and they tend to spend more time outside. However, despite all these possible consequences from climate change, there's also ways we can adapt to them. For example, in terms of floods, we can build early warning systems, enhance natural water retention, or create no-build zones. Or for water scarcity, we can try to store water or build irrigation. Or in terms of food security, we can diversify the types of crops we farm or build pest control. However, and most of those adaptations options are not yet leveraged to full potential, meaning that there's a lot of consequences and adverse effects on health that could actually be avoided. However, the reason why they aren't avoided are mainly the two reasons. One is human health and financial resources. And here I'd like to start kind of getting a bit into the finance part. Is currently less than 1% of climate finance goes into health adaptation, which of course means that there is still a huge potential. And also adaptation finance in comparison to climate or mitigation finance, more precisely, is still very, very small. And while it is possible to adapt to the consequences of climate change, those adaptations also have limits. For example, small islands that face challenges with fresh water supply can only adapt to those challenges to a certain extent. And after this point, they can no longer mitigate those consequences any further. So now to focus a bit more specifically on finance, what is actually needed to secure the energy transition? Per year, we would need around $6.7 trillion annually until 2030, which is, of course, a lot of money. And we currently do not match this even closely. We're currently at around 2.6 trillion. So it's almost 4 trillion that is lacking each year. And there is growth in climate finance. However, it is concentrated in a few developed economies. And also, when speaking from absolute levels of finance, it is also concentrated at 38 developed countries who receive around 47% of investment for climate finance. And then further 43% go to China, India, and Brazil, three economies in transition. And now I think this is a quite striking point. 140 economies in transition or developing economies receive just 7% of climate finance. And this is a hugely underrepresented point, I think, because it very strikingly highlights how misdirected finance flows are and what should be done to make sure that everybody receives the finance needed to actually finance the transition. And part of why finance is directed the way it is that current financing instruments are tailored to developed economies or economies in transition. So in order to be able to actually reach developing countries, the financing instruments need to be changed and the focus needs to shift towards impact away from profitability. And example instruments for this include debt cancellation or philanthropy. And furthermore, it's not just the kind of finance instruments that we use, but also who they are directed to. So it's very important to make sure that the finance flows to the ones that are most in need. And besides those finance flows components, developing countries also are faced with a unique budgetary dilemma, meaning that high upfront cost of renewable energy projects compete with other expenditures such as education and healthcare, which are also very crucial for them, of course. And this challenge is even more striking for economies that still rely on revenues from fossil fuels, because these revenues will continue to go down as fossil fuels are being phased out, and they will still have, of course, the additional expenditures. However, there's not just trade-offs, of course, between health or energy transition and within the health and energy transition, but also synergies. For example, clean and affordable energy improves the provision of healthcare, for example, through lighting equipment and administrative tasks. And it is also a key factor for heating and cooling to prevent adverse health outcomes. And especially cooling, of course, becoming increasingly more important as global average temperatures rise. So I hope I could shed a bit more light into how climate finance works or doesn't work. And to close, I would like to also touch a bit on a point that is kind of highlights the mechanism of the international policymaking process and how it might endanger policies that feature an inclusive and just energy transition. And also, of course, because we're just ahead of the next meeting of the WHO Executive Board, it's quite convenient to understand a bit how this works. And delegations to these negotiations are usually mandated to represent their governments. So they are not able to speak on their own behalf, but have specific positions that they have to defend in debates. And these mandates, they do not always have a specific focus on the ones furthest behind, but usually are more tailored to population averages. Of course, this does not apply to every country. Some countries, for example, also have specific speaking points on, for example, indigenous people and local communities, but there are also many countries who do not have this. And because not everybody has this, in the worst case, the lack of specific focus on the ones furthest behind may, by bad coincidence, lead to circumstances that replicate to policies that replicate the circumstances that put the ones furthest behind in this very position. So as a result, this means that policies should be designed specifically with the ones furthest behind in mind, or ideally together with them. However, the policymaking processes are not always, or not to this extent, designed to function in this kind of way. So it would be very important to either redesign them or to develop knowledge or processes that can adapt to the adequate integration of marginalized peoples. Yeah, I hope I didn't use too much time, but I would like to now give the floor back to Pasi. Thank you.
Thank you, Lawrence. And no, I keep saying you didn't use a lot of time. That time is for you to unpack and to share with us. And I really, really love a couple of things that you mentioned, and I will not be saying all of them because of time, and I want everybody to speak. But I think the thing that is stuck on my mind is this debate between available climate financing and the whole discourse about how countries that have been at the forefront of being the major contributors to emissions that have then led to the need to transition, but also to find mechanisms for mitigating the health impacts, the safety impacts of these transitions and climate actions that have affected communities on the ground, vis-a-vis the amount that is actually needed in resourcing to see it possible that these people are well financed to be able to meet those solutions that are required. So there is an interesting debate there of blaming what is available, what is actually needed, and what happens moving forward. And I think that was the whole discourse during COP 29 last year. But I want to shift us a little bit from that conversation. We will be coming back to it. And I love that you've given us a sneak peek and a taster of what solutions could look like. And I love that you brought the issue of the amount, the 1% that is actually allocated in terms of finance when it comes to health and climate issues and addressing that. That's a critical point. But I want us to move the conversation a little bit. And I'm going to invite you, Ida, to come back now into the conversation and share with us your perspective of this conversation, not just from the wealth of expertise that you have working in private sector, but also interacting with member states a little bit. From where you sit, where does this conversation on energy transition and health rights really need to be, put a pin on beyond what we've already discussed and financing and tech? Where else should this debate be focusing on for us to reach that future that we truly desire? Ida.
Thank you very much. I think we've kind of touched on it in terms of whether we talk about where we're getting the minerals for the sector to develop technology. When we're talking about displacement and the social disruptions that happens, especially with the utility side, solar and wind. But what we don't seem to be saying is that the community needs to be at the center of this, the human beings. So, for example, if you're looking at wind or solar, there's so many ways we can look at land tenure, which is where the disruption starts. How do you use the land in the community? And not to assume just because the community, for example, the mass speaking group you've talked about, or Turkana in Kenya, to assume that they should be happy with a project coming in. Have you sat down and found out what the cultural context is, what the real challenges are, and what it will mean in terms of even just how they socialize in that area? Because the minute you disrupt all that, you impact on the physical health and the mental health that we never talk about, that will be generational, and historical. So one of the things we're seeing in the private sector, particularly because that's where we'd normally be hit, is a growing sense that we cannot go in and just because you've got, financing from wherever you've got it to put in 300 megawatts that we're desperate for, how does it impact on the community? How more innovative can we be in how we set up, even if it's the turbines, if you're looking at how you even split up solar farms, so the imprint and impact is not just on one community, but to take the time to have those conversations and not parachute. And so you were always in a situation where you have the financing, you have the will, you've done the studies, but you've got government who are also desperate to get the electrons online and are willing to run ramshot of the community. And we've been seeing that. So a couple of companies I've been with, based on how we've learned how to work in Australia, what we're doing now in Tanzania, and also trying to navigate how our land laws are, because that's where the trip up is, how we view land and how we view citizens when we're expropriating land. We tend to think that people you can just uplift and take away. And that right now is not going to happen, because I think communities have decided enough is enough. First of all, you bring all this power at utility level. All we're seeing is lines above and saying, oh, you've got access to electricity, but what we know is that they're not able to connect. So it's just useless for them. And so how do you have the two working together, looking at the government policies, looking at how you include them, and also accepting if they say no is no. It doesn't matter, that is the sweetest win spot. And so the groundwork now we're seeing, where it used to be a year where you can go from your feasibility, environmental studies to shovel ready. Now we're looking at 2-3 years to understand the land tenure, to work with government as well, to figure out more innovative ways and with the community, and to understand what they plan for their land. So you'll find it's far to reach places of the village because they have titles. Areas where they're, saying we're willing to move this and adjust. But if you don't have those conversations, then you're going to go back to the same pain points of polluting areas that you shouldn't be polluting because you don't understand historically whether there was a river or a stream there, or the remains of their loved ones. You'll be looking at noise pollution, which is when is the right time to even have construction. and in particular, like a country like Tanzania, where we have also major religious considerations. You don't want to be having it during Ramadan, things like that you have to take into account. You also have to make sure that even who are you bringing into that space, whether it's for construction during that period, how will you disturb it? For example, some of the really good sites we have for wind in Tanzania is in Karatu. In Karatu, we have a lot of indigenous communities, including the Hadzabe, who virtually nobody talks about in Tanzania. And they've been impacted on in everything, including tourism. So we seem to extract resources. So how do you make sure that you don't do that and the ills that come in? How do you scale up? If you're looking at artisan level training technician, we are skewed in the engineering part in Tanzania, where we've got more engineers and not enough of the artisans. So how do we build that skill and make sure we can repurpose people and also have employment? So there's no point having the sector growing. You're going to impact in terms of the community when you've got a huge youth glut in the area. And also when we're looking at air pollution, many times we talk about air pollution from the perspective only of fossil fuels. We never really look about what the impact will be during the short period of construction, but over time. So if you're going to have wind turbines in a place that is fairly dusty, what sort of regime do you need to make sure that you keep the dust down? If you're going to do that, where you get in the water? If you get in the water, what does runoff look like, so you don't contaminate the very water that the communities are using, and understanding that. So more and more you're saying those are the questions we're asking ourselves in the sector. But more importantly also, if you're going to bring all those people in there, how do you make sure that basic services are provided for and are connected? There's no point having a lovely hospital in the area, and when they have an emergency in the evening, they cannot switch on the lights because they didn't pay a bill. So how do you subsidize that? And from a private sector perspective, it's not about just corporate social responsibility, because people are throwing that around. It means that the community is going to see the benefit and see it as a plus. But last but not least is also having them have shares, so they can actually have some money in the community. So one of the things, a couple of companies we've been working with, and it's been successful, I know in South Africa and indigenous groups in Australia, is having free carry for those communities. And funny enough, you'll find the government does not want that, because that means now you're having communities who will have access to independent financing for their coffers and start building what they want, as opposed to what is being directed to them. And examples of where the Aboriginal communities are in Australia, that has really been working. Down to one of the companies I work for, we did not have board meetings in the cities. We had board meetings literally in the middle of the community, so everyone can come in and decide what next. If it's down to even opening bank accounts for the village government, for whatever it is, to make sure you even give them the skills to be able to manage those monies that are coming in during development and during operational. It's not enough to say they don't know. It's what else are we doing, and not to become nannies when they can. So where this has worked, we've seen a huge difference in the community. And seeing a huge difference in terms of how they advocate for their own rights, and particularly health rights. I think I'll pause there for now.
Wow, brilliant. And I love that you touched on the things that we were not talking about and that we don't consider, and bringing us back to the people who should be at the core of this conversation, and that is the community. I really picked up, and I'm going to move on to Zagi from this point, Ida, about how communities are beginning to slowly be empowered to have access to independent financing, which then leads them into a place where they can have quality energy independence at the community level. And that, even how that could idealistically trickle into having sufficient energy to power, clinics or healthcare institutions that are currently lacking in different parts of the world and for very many communities. And I'm going to cite the work being done by a good friend and a colleague, Dr. Charles Ume, whose his organization does telemedicine from an angle where they try to use tech to access communities that do not have healthcare facilities. And lately he's been toying with this idea of energy access and tackling climate affected areas for the purpose of reaching, those communities that are not yet empowered at a level where they have energy independence, but also access to healthcare. And then it gets even worse if they're the community where a wind farm was erected, and it's a dusty place, and now all the healthcare issues that come with that, right? So it's a very interesting conversation, but we now begin to see how it is very multifaceted and how we can tackle it from so many different angles that we need to think about. I'm going to pause there and invite a very good friend and colleague, Zagi. Zagi, I'm going to give you exactly 30 seconds to introduce yourself, because some of us are not familiar with you. And then just share with us from your perspective. Again, your perspective will be a private sector one, because I know you have an organization that you started for the purpose of promoting renewable energy in your country. And you'll tell us where you come from as well. But also, you've been working very closely with a new fund that has been, sourcing different funding to give to youth organizations, grassroots youth organizations, for the purpose of climate action. But also, you have seen, and I have seen together with you, how health has become a major topic as to why some of those young grassroots communities are seeking funding that they usually don't get. So Lawrence talked to us about how only 1% of financing goes into climate and healthcare nexus. We know from the work that we have done that for the youth who are in this space, it is 0.04 something, which is even way less than 1%. So Zagi, I'm going to give you the mic. Introduce yourself, and please share with us your thoughts and your perspective on this subject of energy transition and health rights from where you come from.
Yes, thank you so much, Pasi. Thank you so much to invite me to become one of the colleagues that share the experience, especially in Indonesia. So actually, I have an organization called by Society of Renewable Energy. So, and Pasi, may I share my slide? Okay.
Yes.
So here is my organization. So we are established since 2019. We are start very small members, and within 5 years we expanded to the 50 universities across Indonesia. So basically we want to increase the awareness and also practical experience, so youth can innovate and also collaborate each other. And this is our mission in Indonesia. We want to drive 12 million population to be able to drive a very clean energy and also sustainability movement. And we forecast Indonesia needs 8 to 13 million green jobs by 2045. And this is the details of the energy. So we have green jobs books. If you wanna, download the book, you can visit our page, the sre.co.id. I can write it down through the chat. And this is our roadmap to be able, increase the capacity building of the young generation. So we want to focus on the rural electrification. So we have to, create a very tough young generation to drive a better electrification, because Indonesia is an archipelago country. 70,000 island that we have is very big, and it's very difficult to reach to the outermost area within a month, a year. But actually our member is very tough. We can reach all the island in Indonesia. And this is the type of our organization activities, hands-on workshop, and also training of the trainers to be able to make it sustain of the program itself, because the rural electrification have very challenges. So we have to create a better community in that area, and we also encourage the local community. We call it local hero to become, to get the certification from the government to maintain the system itself. And this is our ecosystem and also the learning materials. We very focus on the sustainability aspects. especially there is an health sectors that we can tap in, but I can share to you in the next slides. So here is the taxonomy of the health energy. So we break down into the clean power system, clean transportation, rural electrification, and also the circular economy tourism. So most of the system that we already installed in the rural area, because rural area is very needs electrification. Indonesia still have more than 100 villages. Actually, so specifically more than 140 villages have not electrified yet, but 4,000 villages have not reliable electricity. So our mission to be able to bring the renewable energy system to democratize the energy access, and all the activities driven by the young generation. And we get several funding from the government, from the international grants, from the CSR budget. So we create a blended finance and we put it into our foundation. And we also encourage the young generation in that local area to be able crowdfunding to increase the sense of belonging of the system itself. Otherwise, we cannot make it sustain in the rural area. And most of the system for the health energy sectors, like the small facility, because women very need some enough electrification for the for their birth and so on and so forth. So we install the solar PV in the rooftop of the small facility, like the small hospital in rural area, to electrify the health machine, and also the cold storage to be able to store the medicine and so on and so forth during the pandemic in Indonesia. So our organization installed a very modular container consists of the vaccine itself to be able to distribute into several islands in Indonesia. We collaborate with the state-owned enterprises that very focus on the health sectors, and we also encourage the other sectors to be able mobilize the funding to create a wider impact. And this is the map of our activities in Indonesia. You can see in this slide a very unique approach from our organization, from east to west, and then all the system installed by the youth. So maybe 30% of the system is dedicated to support the health facility in the rural area. So all the system managed by the local community that we already trained before, and also we encourage them to be able to operate and do the maintenance activities. So we don't want to worry anymore about the sustainability of the system. That's the key. So this framework can be replicated to the other countries, especially in the archipelago country. But yeah, not limited to the archipelago. All the country can replicate our system to bring a better health access into outermost area within the nation. And yeah, maybe that's all, Pasi, to be I'm happy to discuss with you guys regarding the health facility powered by the renewable energy and all the activities driven by the young generation. Thank you so much, Pasi.
Great. Thank you so much, Zagi. And you were perfect to come in at that moment, because what your organization is doing is a practical example of how young people have taken action into their own hands to fundraise, but not just to fundraise for the purpose of doing advocacy, but for doing real life tangible examples of what real green energy access means for rural communities in Indonesia, and how that trickles into having infrastructure that supports cold storage, as you had said, storing medications and vaccines during COVID and other health crises that we have had, but how it just talks about how a small move or a small not really small, let me not call it small, but the effort to actually find the resourcing to build the infrastructure and to bring energy access to communities that do not have it can have an immediate trickle effect in how we store, use, and give then access of such medication and healthcare to different people. And I saw Nicoletta commenting that it only came to the panelists about, you know, how the spread of what you and your organization have been able to do as a youth organization has spread across Indonesia. So that's a perfect example of how it's practically being done. Questions are already trickling in, and to address some of those questions that I've already seen coming in, I want to invite my friend and colleague Nicoletta Dentico to then dive back into this conversation. And Nico, as you kind of become the person who takes everything that has been said and kind of consolidate it in a beautiful whole that we can then grasp and run along with, there's a question that has come in, and you might be the perfect person to answer this question, given all you've heard about energy transition, knowledge, finance, what's being done in different parts of the world. What is the impact, according to you now, of this energy transition on health rights, especially at the local, regional, and global levels? And this has come a question from Duncan Comey, he's like, we've had all these amazing things, but he wants to hear what is the actual and apparent impact of energy transition, that energy transition has on health rights for local, regional, and global citizens, and how can we find entry points to safeguard health rights before diving headfirst onto the adaptation bandwagon of these new transition technologies in the energy sector. This is where I would like you to enter the conversation from. Nico.
Thank you so much, Pasi, and very many thanks to the people who have preceded me. I really would like to, particularly acknowledge the first slide that Shalom presented, but also the elements, the financing elements, and the governance elements that Laurence identified, and the competence and qualification and the positioning of diplomats or delegates when they are in the field. I really want to kind of, embrace completely Ida's approach on putting people first and having people at the center, and using energy transition as a powerful methodology to democratize societies at a moment where even, advocating for the public role, which and the public function, which is an important advocacy line, but becomes increasingly problematic as we see the world, going at national level and also internationally being pretty broken. And then, of course, Zagi's project and how this democratization and ownership by young generations and generations, not just the young people, but people, communities, and individual and local enterprises, with the role of, I guess, the small and middle size enterprises. Also reshaping the discourse of the relationship with the private sector. I think it is a very important lesson that I get from what you have said, and which needs a further elaboration. Now, your question, Pasi, what is the impact on health rights on energy transition? Well, what I can tell you is I don't think there is a number, or there is a general kind of assessment yet of this. I will try to also rephrase it in another manner. You can see all the reports, which I think is part of the problem. You can see the reports on the implementation of SDG 7, for example, for all its different implications for different dimensions that you have for the impact on health, for example, electricity, heat, transport. Health it's very superficially, generically mentioned. There is no real monitoring of what is going on in terms of changing people's quality of life. And health is usually the most precautious and reliable indicator of this change of the quality of life. But I don't think there is much as yet. Certainly not at the local level, not at the regional level. There are a few numbers here and there, but we are still analyzing these issues pretty much in with a siloed approach. So you have the health reports, you have the energy reports, and the match is not yet achieved. There is a little bit of knowledge about what the current development model, I think it was Shalom or asking, you know, yeah, we've used these fossils so long for what? For development, for growth. Okay, so now we are seeing after 4 decades of totally unregulated approaches in this arena and totally financialized strategies attached to that industrial model, the impact on health and health rights. Although, of course, I think we needed to increase the discourse here, I mean, to expand a little bit the discourse. You said it at the beginning, Pasi, correctly. Yes, we're talking about health rights, but we should be talking about human rights and planetary rights altogether. I think we need to mention here one rather junior right that is often kind of neglected, and that is the 2022 right to a healthy environment, which I think is actually maybe the hook that we should use and densify and intensify in our work, because that's a very comprehensive, it embraces us all, and it embraces us in our different perspectives that need to come to a convergence. Anyway, when we talk about figures and numbers and impacts, as you requested, the environmental pollution and that is closely related to energy consumption and also misdirected, let's put it this way, energy policies, along with other environmental risks, usually cause on a regular basis, as analyzed over the last 20 years, at least 1/4 of worldwide disease burden. So at least 25% of the disease burden is actually associated to all the issues of slowed or contrasted or still not understood or not implemented energy transition. Because we are talking about energy transition, but let's face it, fossil fuels consumption is growing. Is growing globally. Yesterday, we were talking in another webinar about glyphosate use, and we were talking about glyphosate use for biofuels productions, which is a bit of a catch-22 because that creates another layer. So 25% of the burden of diseases is associated to all this mess. I call it a total mess of a misunderstood development model. And to go into, according to the WHO figures, let me do my part into this. So let me bring some of the WHO classical figures. We have 31% of deaths from ischemic heart diseases, 25% of strokes, 25% of lung cancer. Other types of cancers are not yet monitored. 43% of acute respiratory diseases, 33% of chronic obstructive pulmonary diseases could be prevented through an intentional reduction of air pollution, through an intentional reduction of fossil fuels, and through basically the implementation of a serious, reliable energy transition. But I give you another figure, which is a bit encapsulates where we are today. 40% of road traffic injuries could be reduced if there were measures to improve transport policies towards a greater investment into public transports that are safer, that are more reliable. and should be better regulated, moving away from the current totally unregulated use of, or misuse rather, of land and built infrastructures. So there is a massive amount of impact that can be made. I mean, I'm giving you not even numbers, but percentages. We should not disregard the fact that these are not numbers. These are people's lives. These are people's conditions of life all over the world, because, you know, this issue of energy and climate change, in a way, although of course the impact is may be different, and the conditions that the conditions that in livelihoods and in you know, housing may be different, but this is really a great opportunity to also overcome this global north and global south type of you know, division, because we're all in this. I mean, people, Lawrence was referring earlier to mental health. Mental health is still not properly recorded, or is not properly, because it's more intangible, if you like, even than other kind of diseases which you can measure. But mental health is a huge, the fear, the anxiety, the uncertainty of extreme weather events, which should not necessarily happen once. I mean, in Emilia-Romagna, just in my country, people have to be evacuated 3 times in 6 months. And you know, and that actually makes you think that you have to completely change and turn your life upside down, because you can no longer live where generations have lived, where your family has been rooted. This creates incredible uncertainties and you know, a sense of failure of your life altogether. And I can say it because of speaking to people that are really, that never would have thought in their lifetime that they should be, you know, taken by helicopters and just removed from the flooding. I mean, this is mind-blowing. It's really harrowing. So we're talking about people. And I'm thinking of the Maasai, the pastoralists, you know, the Maasai pastoralists in Tanzania, for example. I had the opportunity to talk to some of the organizations working in Tanzania or Mali, who find themselves completely, or indigenous populations in Latin America. Their very identity is broken by all of this phenomena happening in such an accelerated way. So the health impact is although we want to measure it, in a way it's so immense that we will never be able to really measure it. And this is, however, people. It is communities. It is those very people which Ida was saying should absolutely stay at the center. Mm-hmm. Now, if we had a serious preventive action, health is about it's about health promotion, you know. Health is about preventing diseases. It is not about this overarching, domineering, and so powerfully influential anthropogenic approach of just curing people, treating people, looking at the therapeutic last mile. We should be looking at the road before the therapies. I'm not against therapies, of course. I'm not against the use of you know, hospitals or medicines or diagnostics. Far from it. I have a recorded history of being with the Access to Medicines campaign. So medicines are important. But the problem is that if we disproportionately focus our attention on the medicalization of health, and we don't work on the preventive part, especially, you know, in the face of the reality we all live, we are basically getting it all wrong. And we are getting it all wrong for 2 reasons. Because there is, the WHO itself has developed this logic of looking at health from a totally disease perspective. And for example, you know, mentioning the social and environmental determinants of health, but in a way neglecting them. It's part of the discourse, but is not really yet a priority. And when it is basically around solutionisms that have to do with technological approaches, which, as you said, Pasi, are important. But let's not forget that all hyper reliance on artificial intelligence, big tech solutions, it's another layer of pollution of environmental pollution, because that's a reality as it is, in everywhere. So we need also not to contradict ourselves too much, but rather look at the way in which, as Ida was saying, we can do the scale up from the communities through approaches that are, in a way, grassroots upwards and not just biotech downwards only, which is what basically the WHO does. So there is this hyper biomedicalization of health, which is problematic. Of course, it is in the interest of especially the pharmaceutical sector, but not only that. I think it's also, it's also now the big transnational corporations are very coordinated among themselves, like and they work together. It's the pharma, the digital, the food, all together. And then, of course, I think we need to do it. We cannot do it as yet, and we need to do it because the civil society, academia, even research institutions are still very siloed, are still working at issues one by one. And climate change, one, energy, one, health, one, food system, this can no longer work. So we need to completely reframe the paradigm, and also I would say the university training of people that need to look at health in a completely different manner as they, if I compare it to what they do today. So there's a lot to be done. I think studies are emerging on how energy poverty impacts on countries like UK. In the UK, for example, they have started to consider canceling debts of households in the UK, because more than 1 out of 4 households are actually indebting themselves to try and combine, heating and eating. Heating and eating. Many of them cannot do both things. So these are actually absorbing an enormous debt burden that they cannot pay. So, this is time to really think out of the box, completely think out of the box. 2 final comments. Lawrence was talking about the 6.7, if I'm correct, the 6.7 trillion that is necessary every year to, meet the targets and the ambitions that have been flagged so far. Well, this is really peanuts, if you think. If you compare this figure with the 192 trillion US dollars, which the high-income countries and the corporations that they harbor have actually accumulated through atmospheric appropriation. This is a figure that was actually highlighted by Nature, the Nature publication in 2023. So I'm sure that if we just basically reproportion this enormous accumulation of capitals on the one hand and redistributed them in a kind of with a just transition also financially, we can cope with the 6.7 trillion. One problem that we need also to face is the quality of the delegates. At the WHO, most delegates are diplomats. So this means that they don't have a specific competence. And yes, you're right, Lawrence, that they get what the capitals tell them, but they don't have the technical capacity to, in a way, bring back to the capitals in a, elaborated, structured fashion, the type of policy dialogues and negotiations that they are dealing with when they are in Geneva, when they are in Rome, when they are in Nairobi. So we need to basically requalify the capacity of delegates, because apart from receiving the inputs from capitals that happen to be heavily permeated by conflict of interest or revolving door type of things, they do not kind of have the capacity to fight back and to give arguments for a better policy in the very country's interest. Because here, you know, we can still follow the interest of the very big private sector, the huge one, those that are basically financializing the whole thing, but this is not doing good for your own country. And this is something that even Donald Trump has to learn. American people will actually, you know, have to tell him that if you go with drill, 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 baby, drill, 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 this is not in the US interest. I will stop here. I hope I have, you know, covered a little bit what you were asking. Thank you very much.
Thank you, Nico. And I love that you started off by encapsulating everything that was said prior to you. Again, just like I've done with everybody, what is stuck on my mind is your answer to this question on the health impacts of the energy transition, on not just health impacts, but also human rights impact. And this need to actually track what the actual impact has been and the gap that exists there. And I think this would be a very valuable entry point into how we move this debate forward. And I'm kind of looking at Alexandra and the team at G2H2 to kind of be the people that we work together with to champion what would it take to get to a point where we are tracking that impact, churning out the necessary data and knowledge and research and impacts that we need to put out there for the purpose of truly meeting those needs. And the moment we begin to do that, if it is possible, even if it's just like a fast step tracking process and working with people like WHO or research institutions on the ground, and also just to mention health practitioners, they should be part of this conversation because they are the ones who receive people with some of those chronic health impacts that are, disease related or illness related. But beyond that, these are the people who also need to be part and parcel of this conversation. So that has stuck with me, Nico, and I think that would be a very good way to move this conversation forward. But we've talked as experts on this panel, and I would like to invite the voice of some of the participants who are joining us. We have extended this session by a little over 15 minutes, just 15 minutes past the 30th mark that we were supposed to end, to allow you to also give in your voice. So you can ask questions or give comments. Feel free to raise your virtual hand, and I'm sure Alicia or Alexandra will see it and invite you to speak to us. So as I wait for that to happen, I will quickly go into the chat and just, I see some of you had already put in comments there. So I'll check with you, Alicia, if we have anyone who is burning to contribute to the conversation yet.
Looks like indeed we have a hand raised from Samuel, and maybe Alessandra, you can give him the words.
Brilliant. Samuel, my good friend, you have the mic. Karibu.
Thank you very much. Can you guys hear me?
Yes.
Thank you very much, because I've followed in the conversation and I have, interacted with some of the issues that I have come face to face with when, in the field, when you're doing some of the research. As Percy indicated, I have one of the papers that deals with the local communities, that is the Maasai community in Nakuru County. And one thing that happened that relates to health, I'd say, came mostly from the evacuation, because they were forcefully resettled. And so when you find these people having to, begin looking for a new form of livelihood, begin to having to change their lifestyle, it really affects them mentally. And it was one of the issues that appeared quite much. And to point out, one of the things is that the most affected also were the women and the people with disabilities, because I was coming across cases where the areas where these people have been resettled, even access is quite a problem. So you can imagine how these people with disabilities will have to be, moving, or will have to be doing their day-to-day activities. I was also lucky to be engaged in a research on multi-sectoral needs assessment for the refugees in some of the camps in Kenya. And energy still came up as a health issue because most of the young girls and women were raped by the local communities as they go to fetch firewood. And you would find a crowded household. You can imagine a whole family from South Sudan that has come, and they have to put into families into a poorly ventilated house, and they have to use this firewood. And I may not have had the expertise to understand some of the health issues, but they talk about constantly having issues that arise out of the energy sources they are using. Lastly, I also got an opportunity to go to an area in Kenya called Homa Bay, where there is a project that is coming up on building up a geothermal village where the local communities can access, the geothermal, the geothermal, because I went around to looking at the source of they use. You will realize that health issues because and they access that, and it affects women actually. So I think this is a timely topic, and I'd always be ready to come in. I will reach out to the other teams so that we can see what we can do on this. And thank you very much.
Thank you so much, Samuel. I love that you've come in and given us not just the health impact of some of these energy transition developments that are happening in different pockets of the world, but you've also shared with us the health impacts of energy poverty, direct or indirect. The energy poverty causes people to have to go look for firewood in long distances, and the impact that has on women, not just health-wise, but security-wise, which I think is a brilliant way of putting it. And we need more of these examples, which is why we need that tracking of these impacts. Alicia, I wonder whether we have anyone else who'd like to contribute to the conversation?
Yes, indeed. There is Andrew who raised his word. Andrew, I believe you have the floor now. You can speak.
Brilliant. Welcome, Andrew. Yes, please. Andrew, can you hear us? We're going to need you to unmute yourself so that we can hear you. Alicia,
Yes.
oh, great. There you go. Yes, we can hear you.
Thank you so much for this opportunity. I want to say that I'm glad to be part of this virtual conference. It's actually the first I'm attending like this. And it means a lot to me because I'm from a place where I don't get to have professional conferences like this. Okay, I came from a place that is highly energy deprived, and all these things that have been talked about today has really reshaped my mind on how we can tackle climate change and improve energy access. But my question is, what specific actions can I take as a youth who really wants to see my village transformed and taking away that barrier of energy poverty? What action should I take? I have tried to take some online courses already, trying to train myself on renewable energy, net zero, and topics around energy transition. But I just want to find myself being able to, solve a real problem. So that's my question. What action should I take?
Brilliant. Thank you. And we have taken that question when I'm going to be doing the final round for panelists. I hope this is a question that will be able to help Andrew to answer. And we really like this first, to how can I be part of contributing to finding the solution? Very good question. Alicia, I believe we have one last final question before we bring it back.
Exactly. I would kindly ask Andrew if you can unmute now so that we can give the floor to Charles Ume. You have the floor, you can unmute yourself and then address to the panel. Thank you.
Okay, I don't know if you can hear me.
We can hear you loud and clear.
All right, so my name is Dr. Charles Ume, and I'm from Nigeria. And so I am a public health physician, and I'm the director of an organization called Pakas Mobile Clinic, which do health system strengthening in Southeast Nigeria. So basically, we support the government, the Ministry of Health, in order to strengthen different aspects of the healthcare system by working with mainly rural communities in order to design different health solutions and solve their problem. So over the past 5 years, we have noticed that, issues related to energy, especially in the area of power supply for the health centers, is actually one of the issues that most people don't talk about. We are always interested in talking about other key health areas like communicable diseases, non-communicable diseases, tuberculosis, HIV, and other areas. So, but from the assessment that we have done over the past few years, we have noticed that, if we solve most of these problems and then we overlook areas like energy, we most times even will not even have the opportunity to deliver the services that we want to deliver. So I believe so much that based on the best practices that we have also seen in some other regions in Nigeria, where solar-powered health centers and solar-powered water systems that supply healthcare centers. Based on the kind of result and the improvement in the patient outcomes that we have seen in these other places, we have noticed that there is these high chances that if we can try to put in more energy in trying to increase the level of solar installations that we can do within the health centers that we cover, and that it will even help us to do service delivery better within these areas. So what I'm also advocating is that, there should be more funding in direct service delivery at the field level, and this will most likely be in the area of trying to make sure that most rural communities, most health centers located within rural communities can be able to have access to clean energy like solar. Because even here in Nigeria, we are still having issues with power, whereby over 60% of the citizens in Nigeria don't have access to 24 hours power supply. And so those rural communities even have much more challenges, because it's either poverty cannot give them the chance to pay for electricity bill, or they are already living in communities that is hard to reach and is being overlooked by the government. Thank you.
Thank you, Charles, for that question. We were speaking the other day and you're telling me how busy you were. I'm so happy that you were able to join and contribute to this conversation, because as you heard, we were just saying that we need more health practitioners chiming in and joining this conversation, because only you guys also know the impact of having that solar panel on top of a rural clinic or hospital, what the impact that has on those communities. So I'm really grateful to you for that contribution. And I also want to thank Andrew and Samuel. Unfortunately, Alicia, I'm checking with you if there's any other question, but I had said, we close there so that we can bring the conversation back to the panelists. So thank you to Andrew, Charles, and Samuel. I want to bring the conversation back to the panelists, and I'm going to do it in this way. I'm going to give all of you, because of time, just 1 minute, 30 seconds each to kind of try and respond to the comments and the questions, but also to kind of wrap us up, having gone round from your talk and back to you. So I'm going to start with you, Shalom. What are your closing remarks, or what are the thoughts that you are left with that you want to churn out? And if you want to start by answering any of the comments or questions, and then you can give us the final minute as your kind of closing remark, and then I'm going to go around, and then we're going to close by 45 past. So Shalom, over to you.
Thank you so much, Fasi. I've written, this is like 3 pages full of yeah, I have like 3 pages full of the insight that I've gained from the panel. I'm so happy that I joined this conversation, and a lot of the people that I work with at Renew Technologies, they are here as well, and they are already sending me information on this is great. Thank you for sharing this. And so, and I do not want to reiterate things that has already been said because I feel that they are already captured. But the other things that I wanted to bring light to is the area of research, because we kind of mentioned that, but I wanted to emphasize it. And that's the reason why here, and that's the reason why I started a doctoral program in the first place, because it wasn't just only about advocacy for me. I also wanted to back the advocacy with scientific proof of whether it is my claims on the impact on low-income communities or the impact in the world generally. So for us here in the US, it's the transportation sector that has the largest share of the greenhouse gas emissions. So the research that I do is critical in the sense that we design tailor-made biofuels. So we decide the properties of the fuels and we make them such, design them mathematically such that these fuels either match or outperform the current fuel solutions. And looking at the biofuels, we also do the techno-economic analysis. So we need to be sure that the solutions we are pushing out there is cost effective. And also we perform a broad life cycle assessment that looks at the environmental flows and the contributions of each model in terms of, okay, water use, like we mentioned, water consumption, resource use, the health indicators too. So when we talk about measurement of the health impact, this kind of research is critical because you can see underlying indicators from the health sector that we can trace to see that, okay, this is the direct impact of this energy model or this biofuel solution to the world in general. And so this is not the only place where this research is, and I really appreciate the United States, and I think the European Union too, they do a lot of research on that. There's a particular institute in Europe that is dedicated to biofuels designs. And so the area of research is critical. And and answering the question that Andrew had about what young people can do, advocacy is there, then take it a step further through research. People listen to science. And I mean, that's what we try to keep, preaching to I call it preaching because they need to hear. We need to convince them that it's necessary to back policies with scientific-based evidences. And so with research, so you go through maybe a master's program or whatever graduate program that you need to do to reinforce your claims on energy systems impact to the world. So it could be in any sector that you are interested to work in. And finally, I would end it with crowdfunding and partnership, which is something I wrote down from Zagi's his talk. We do a lot of crowdfunding, but we've not done it particularly for solar systems. So I think that was something I took away from Zagi's presentation about crowdfunding and using those resources, not just to do advocacy, but to actually implement physical and tangible products, to these communities, driving more direct impact of clean energy systems in these places. So I think I will end with this. And thank you so much for the insightful panel. Thank you so much.
Thank you, Shalom. And now I am pressed with time. This is the worst part of being a moderator. But Lawrence, I hope in 1 minute you're going to be able to wrap it up and maybe respond to the question that came in. Lawrence?
I'll try my very best. So I think the main takeaways I got from today are we really need to have a systemical assessment of the adverse impact of the energy transition on health. And I think this is mainly because everybody talks about the positive outcomes, but the negative outcomes are still a bit, not really talked about. And I think here a part of the important component is that these negative or potential negative outcomes can vary very much from one context to another. And it's very difficult that if you do not know one context to extrapolate to it from what you already know. So it is a very broad kind of knowledge we need, but if you do not have it, missed decisions are bound to happen. So I think this is a very important point. And then also, I think, Nico, you mentioned this, health needs to more and more be framed as not just a disease topic, but the general well-being of humans, whether it be through injury or being alive because you're not, let's say, suffering from storms or other such things. So it's very important to keep the notion of prevention is often more effective than treatment. I think you kind of hinted on it that unfortunately with prevention, you cannot make as much money. So people usually go for treatment instead of prevention, even though prevention is actually the thing that would be much better for the people concerned. And I think this is the final point I would like to make. Development measures should be designed for the people and not just there to push a certain statistics. So the figures, they need to go beyond just general averages, because often the small communities or marginalized groups just drown within those large-scale averages, which end up then not actually capturing their situation, and of course end up leading to policies that do not actually help out. So we need to make sure that the knowledge we develop actually adequately captures the situations and difficulties of the ones that are furthest behind, without actually ending up trading this for less breadth, which I know is an extreme intellectual challenge, but in the end, this, I think, is what we need if we want to move on in this process.
Great. Thank you, Lawrence. We're going to be kicked out at literally 47 past the hour. But Ida, I'm going to give you your 1 minute, like I afforded everybody. And then Nico, I'm going to give you strictly 1 minute as well. And then we'll hand over back to the team for the next session. Ida.
Thank you. I think just to add on, and thank you for everyone in the comments. You think you've got 3 pages, I've got a lot more. The issue around the technology is so important. And I think getting the modular technology, the smaller and smaller ones that we can get to deploy in the communities, they don't take up much space. They're more acceptable and practical for people. And you start talking about other issues around health that are not related to the technology. But one more thing that we need to also look at is, aside from the fact that we're talking about preventative measures around health and that money doesn't go there, the one counter argument is money does come out of this space of energy, economic opportunities, jobs. That resounds well with policymakers. And I think we need to get our sound bites better when you're getting the spaces with diplomats, not to give them a tome, but to do exactly what lobbyists from the private sector are doing. We sell them the good point really quick and convince them they need it. And so to counter the narratives that normally comes from, communities can't do this, this is not going to work, you need the grid. Last but not least, the allies. We have allies across all boards. And I think we talked about it, Nicoletta, yesterday. Guys, WMO is our friend, right? They're already doing work around heat waves and health. And I know they have a group, but we need to celebrate and elevate that conversation without the onerous scientific words that we tend to trip over. But I'm really happy. Thank you so much. I hope I tried.
Thank you. You did your very best. Nico, I'm sure we're not going to get kicked out until you get your 1 minute.
I'm just following Ida's. I will start with my, practical things, which are also trying. I want to respond. Definitely, I want to respond also to Andrew. But first of all, I think we have to start knocking a few doors that we have not yet disturbed, because as Ida said, there is a risk that behind those doors, there are people that have been waiting for us long. And we are still deserting them. So definitely we need to tap those doors. look at the international institutional level. But let's go then to, from the institutional down to us. I think we need to create, we must out of this webinar create also, if possible, a community of knowledge and practice that is intersectoral, intercompetence, therefore intergenerational, focused on human and planetary rights, and the planetary vision that Sharon mentioned earlier. And then we have to, and here I try to respond to Andrew, what can I do in my village? I think you have to, be in contact with Sharon. Shalom, she can tell you, you are trained on zero net and so on. It's a question of starting, activating educational, funny, interesting educational little programs at the village so that people can start understanding what they themselves can do, and definitely get in touch in a logic of a community of practice with those that can tell you more and expand this thing. So educate and organize ourselves to have the communities at the center, and indigenous knowledge that maybe, can save us in the end if we want to continue living on this planet. Thank you so much to everyone.
Thank you so much, Nicoletta. A brilliant and big thank you to all the panelists that have joined us, Lawrence, Shalom, Ida, Nico. A big thank you to the SID team for working together to bring this policy debate together, and a huge, huge thank you to the Geneva Global Health Hub for having us and providing this amazing platform for us to debate. Until we meet again to continue this conversation, I've been your host, Pasio Mayo, and see you again soon. Over to you, Alessandra.
Thank you so much. I really nothing to add. It was amazing, really. And I need to kick you out because we will start our next session in 10 minutes of the G2H2 policy debates on palliative care. If you want to join us, you find the link, registration link on the chat. So I hope I can still see you in 10 minutes. But if not, it has been really, really great and a pleasure. Thank you so much. Bye. Bye-bye.
Thank you, everyone. More to come. Bye-bye.
Thank you so much.
Thank you.